My name's Dr. Phil Anderson. I'm a clinical psychologist by background, and I'm the Associate Director of Therapies for Older People's Mental Health and Specialist Services in Surrey and Borders NHS Trust. And I'm just going to talk to you about a leadership programme that we've developed for senior managers and senior professionals working in dementia nursing homes across Kent, Surrey and Sussex. So there are lots and lots and lots of documents out there from different organisations that all emphasise the importance of strong leadership in organisations to push forward compassionate leadership, compassionate care. Probably not enough emphasis on it historically, so we're really pleased that Health Education Kent, Surrey and Sussex have identified it as something that needs investment in, and it's the reason why we've joined with them to develop this leadership programme for managers. Some of the reports, I'm just thinking of things like Winterbourne View and the Francis report, which followed really serious incidents in specific organisations, and they themselves have identified that when things go really wrong with the cultures of care, it's often a lack of strong leadership that's led to some of the major problems. What we often recognise is that the staff who work in care homes are very compassionate people, they're very caring and they want to do the best, but they're struggling against a lack of resource or a lack of time, and often they end up working in cultures that are very task oriented and don't provide enough space to think about the individual residents and their personal needs. And we also find that whilst there's more and more training for the junior staff who deliver the care, for the senior clinicians and the leaders, often they don't get as much opportunity to attend training and develop their own skills and leadership skills, which is why we wanted to focus on this going forward rather than thinking of the junior workforce. So the programme that we developed is helping leaders to think about whole system change, whole culture change within care homes. So we wanted to emphasise the fact that it's not just about the care that you provide to residents that's important. You also need to think about how you look after your staff in the care home, how you provide support to them, because the bottom line is you can't be compassionate and care for other people if your own needs aren't being met. So it's that whole system approach that we've been trying to get at. So lead provider, Surrey and Borders Partnership, as I said, we're a secondary care mental health provider, working in partnership with Health Education Kent, Surrey, Sussex and Surrey Dementia Partnership Board, who we sit on, and our small task is to provide leadership training to 100 managers and senior clinicians from 100 care homes across Kent, Surrey and Sussex. Our vision: support the development of confident, skilled leaders within nursing homes who place person-centred values and compassion at the heart of their leadership roles. We want to support the development of compassionate cultures of care in nursing homes that value the person and the emotional well-being. We want to support nursing homes in becoming rewarding places for residents to live in and for staff to work in as well. So it's about how do you get leaders in care homes to get that cultural shift away from medicalised, very structured routine for people, to a more compassionate, person-centred, focused culture of care. And our course tries to focus on getting consistent person-centred care across the organisation. So we talk a lot about interactions between staff and residents, interactions between staff, the peer groups within organisations, and the interactions between the leaders and their staff teams, and how do you make that a compassionate interaction. Okay, so just thinking about the structure of the programme then. So we've got 2 full-day workshops which run consecutively, 2 half-day workshops and action learning sets, and there's a service improvement programme that everyone who attends the course has to develop and implement. And we're going to run this, so there'll be 4 cohorts, 100 people attending, 4 cohorts. We'll run it twice here, once in Kent and once in Guildford, so we get a nice geographical spread, easier for everyone to attend. And just thinking about the service improvement projects, we've piloted the course previously, and the leaders have engaged in things like including an extra staff handover for their residents, which focuses specifically on person-centred elements of care. So they do their normal handover and they talk about how Mrs. X in room 20 has to have X, Y and Z done for physical care, and their project was to implement another handover which focused just on the historical needs and the person-centred needs of those people, and that improved the person-centred environment and culture in the care home. Another care home historically looked at their supervision process for staff, and we worked with them on shifting it from very practical, task-oriented supervision to a reflective space where staff could come and talk about how bloody difficult it is actually to look after people with dementia sometimes, and talk about the emotional challenges of that role. At the end of the programme, there's a celebration event. So all the delegates come along, they talk about their learning over the course of the programme, talk about the development of their service improvement project, and talk about how they've delivered it and the benefits to their organisation, and obviously we give lots of certificates and well-dones to people. For the first day of the course, so the first workshop, that day-long workshop, we start off talking about some really basic elements of person-centred care. So it's things like adapting communication, adapting the environment, thinking of challenging behaviour as being an unmet need, some really basic things that you'd think lots of people would know. And initially when we piloted it, we did worry that senior leaders in care homes might think this was a bit condescending, but actually they really appreciated the chance just to refresh on some of those basic themes. And for us, it put person-centred care at the centre of what the rest of the programme was going to be about. So it set the framework for it all. And then we shift on to help the leaders think about what the culture's like within their own organisations, what's going really well, what are the areas where they struggle with, what is compassionate about what they do. And then we talk about their own stress, so we get them to reflect on the difficulties of their own jobs as leaders and the stress across the organisation. And it's really important because what we're trying to do is emphasise that unless you just stop and reflect on how difficult it can be sometimes and the challenges and the stress that you experience and your staff team experience, you're not going to understand how those pressures impact on the care that you provide to your residents. And you know, if staff teams start to become burnt out, they start to lose their capacity to be compassionate. And at the far end of the scale, as Winterbourne View type reports show, when staff become really burnt out, it can lead to abuse. So not to be too negative, there are some amazing care homes out there, but what we really want to help leaders to think about is how a stressful job, a challenging job, if staff teams aren't supported properly, then it does impact on the care that they're providing to their residents. The second day workshop, so then it shifts seamlessly on to models of care. So we talk about definitions of leadership and management. Anyone who's got insomnia and reads leadership manuals, we talk about transactional versus transformational leadership models. We get the people on the course to think about their own leadership style. So how do they manage certain situations and certain staff teams? And then we help them to think about shifting cultures in their organisations. Really interesting, because I don't think they get a lot of opportunity to sit back and think about how they actually lead their organisations. And as we said before, you know, they don't often get the opportunity, these senior leaders and managers, to go off on lots of courses and refresh their skills. So it's helpful for them to think about what do they do in certain scenarios and situations that were helpful or unhelpful at times. And then after the 2 full-day workshops, about a month and a half later, there's a half-day workshop and action learning set, and then a second half-day workshop and learning set following that. So we'll give more teaching on leadership models and person-centred care. And the action learning sets, they're a really nice way actually to engage a group of people in thinking more broadly about how they approach situations and problems. So you have a group of about 10 people in that action learning set. One of the members might present a challenge or a problem that they're facing, and it's the role of the rest of the people in that group to use open-ended questions to help the person to just think a little bit more broadly about their assumptions and their attitudes about the challenges they face, so they can maybe challenge their own assumptions and think more broadly about different ways to approach things in the future. They take that learning back to their organisations, try and implement different ways of managing problems, and then they bring it back to the second learning set to reflect on how helpful it was. It just emphasises again that you need space to reflect on what you're doing to be able to do things constructively and change things when things aren't working. And course evaluation, so obviously we get feedback forms from the attendees following each workshop. We use the positive approaches to people with dementia questionnaire, and really nice questionnaire. There's two elements to it. So one talks about hope and the other is about recognising personhood in dementia, and we do that pre and post. And often when staff teams or leaders are really tired and worn out, it's the hope bit that gets lost. We've already talked about how some cultures tend to drift away from recognising human beings behind the diagnosis sometimes. Pre and post we're going to do with a percentage of the cohort, 360-degree healthcare leadership evaluation framework. So this has recently been developed, I think, by the Leadership Academy. So we're going to trial that one on about a third of the cohort, and then the rest of them will do a self-evaluation leadership framework. And of course, as I said, we've got a celebration day, so they come and they present their service improvement projects, and they can talk about some of the difficulties of implementing them, what went well, what the difficulties were. And then we'll get some feedback from care home staff on the cultures within their organisations and what might have shifted over the course of the programme. So thank you for listening. I hope that's given you a flavour of the programme. Any questions, I'll be around for the next couple of hours. Thank you.
Fantastic, thank you very much.